Here once again at MD Hair Labs with Dr. Clifton to talk about the hair transplant. Now, when people hear transplant, it's not taking it from someone else, it's your own stuff, but yeah, break this down for them. All right.
Okay, so hair transplant, yeah, you can't take it from someone else.
Yes.
Or you'd have to be on drugs to like prevent rejection, like
Yes.
if you had a heart transplant.
Yes.
So that's not something you want to do, for sure. But you can take it from your own body.
Yes.
All right. The most common type of hair loss that we treat with hair transplant is pattern hair loss, and it can be male pattern or female pattern. In men, usually that's thinning up here at the top and maybe back in the crown a little bit. Interestingly, that's caused by a hormone in the scalp. And some people, all of us have the hormone, but some people who have hair loss have a little enzyme in the hair follicles in the front and in the crown that basically converts testosterone to another compound called DHT, or dihydrotestosterone. And that compound actually makes the hairs thinner, finer, and then fall out.
Okay.
The cool thing is that enzyme is not in the hairs in the back of the scalp.
I was just about to ask that. So when you talk about the transplant, you extract hairs from an area in the head that is, I guess, more fertile, or just the
So
things
that
are
it's
alive
just
and
not
well?
susceptible. Yeah,
Okay.
the cool thing about the hair follicles where we take the transplant from, which is back here in the occipital or the back of the scalp, those hair follicles aren't going to fall out due to hormones. So you can take them out from the back, put them up in the front, and even though that chemical is up there, they're not susceptible to it. So those hairs are going to stay around.
Oh, wow.
And so it's a really cool concept, and it works really, really well.
Now you talk about candidates. I would say this procedure, unlike maybe some of the other ones, would you say everyone's a candidate, or you have to really kind of dial that in?
So not everyone is a candidate, especially for the robotic side of it. People that are really good candidates for the robotic side, which is where we harvest with the robot, those people need to have really good, thick, dense hair. It needs to be pretty dark, needs to be really healthy. And you know, we really like for those people to not be too far gone, okay? If you come in here and all you have left is a rim of hair, sorry man, it's too late.
It's too late, yeah.
You should have been here years ago.
Fair enough, fair enough.
So I would say, and I would encourage anybody that's listening to this, if you're starting to experience hair loss, you really do want to get on it quickly.
Yep.
Because there's medical interventions that can prevent it from even getting bad, and that's super easy, and we love those candidates. We love seeing those people that we can help without doing big procedures. If it's starting to get a little bit more severe, we have tons of options. We have lots of injectable treatments, we have a laser treatment, and then we have hair transplant.
Yeah, you talk about those other options. For the most part, those are something you can come in, knock those out, maybe 30 minutes or an hour, then go on about your day.
Correct.
What's the process with the transplant?
Yeah, it's not a quick thing. It's
No.
not. We really get to know you. We have some serious, good conversation, and really get to know the people that we're doing hair transplant with.
Yep.
I got to know you very well
Yes,
on
you
our
did.
hair transplant
I may or
day.
may not have. Did I take my clothes off at some point? I think I did. I was on the nitrous. I was on the other
You
stuff.
were in your own
I think I got hot.
realm.
I don't know
You
what was
you
on.
got
It was
very
fun stuff.
steamy,
Yeah,
and
that's
then
what it was. I got hot.
you did strip down a bit.
Yeah, I was like, it's
you
a little
did.
warm in here. Yeah,
You
I
did.
Yeah. I had my underwear. I kept my underwear on.
He did
All
keep
right.
his underwear on.
Yeah, I
he
did.
did.
I
He
did.
was very appropriate. It was fine. He was just very
did.
warm.
It's a good time here.
Yeah, it was all good. We were
Yeah.
totally fine with it. Fed him some lunch, put his
Yes.
clothes back on. Everything was okay.
Good to go.
Yeah, so the process is longer. You come in the morning, we give you medicine so you just don't care as
Yeah.
much, make you nice and relaxed. And then we do a series of little numbing injections where the main nerves of the scalp are so that the scalp is completely numb.
Yeah.
And then we do have to trim your hair down really short so that either the robot or myself or one of the other physicians can hand harvest hair follicles depending on the person and whether they're a candidate for the robot or the hand harvest. Once we get those hairs harvested, we sort through them and we trim them, and we make sure that we have a lot of single hair follicles that we can really recreate the front of the scalp with. We make little tiny incisions, or sites is what we call them, to put those little hair follicles in. And in the front of the scalp, we actually really try to recreate that natural hairline. We don't want you looking, you know, like a Ken doll necessarily. Unless your hairline is completely straight across, that's great. But we really make it look like it's your natural hairline. And we put single hair follicles at the front, you know, that way it doesn't look like a chia pet. It looks really natural. And then we put those thicker and more, the hair follicles that have more hairs within them, we put those a little farther back to give you density.
And then before that even happened, you'll obviously go into it with the game plan. You just don't
Oh,
wing
absolutely.
it. You know what I mean? So
Absolutely.
I know there's the process of the consultation, really looking at that pattern, figuring out exactly what that client needs, and then you already predetermine how many grafts you're going for. When I
Correct.
say that word graft, can you kind of explain that?
So a graft is basically a follicular unit that has 1 or 2 or 3 hairs in it. And that little follicular unit we call a graft. And so you're taking it out and then you're putting it back
So
in.
what goes into the determining factor of how many grafts you're going to extract?
It depends on the level of hair loss, how far back it goes, whether we're trying to recreate just the front or whether we're working on the crown. So it's really customized for every person, very individually. So you're not going to have the same transplant as the guy down the road.
Side effects?
Well, there's a little bit. There's some swelling. We bandage you up, and we really minimize the amount of swelling that people get by doing the bandage for about 24 hours or so.
It'd be best to probably have someone to help you with all that.
We really want someone to bring you here and then to be home with you because you're on some medicines. We do give you some pain meds just in case. Most people really do not complain of pain. Especially the way we're harvesting now, where we're in most cases not doing the strip procedure where we cut out a piece of the scalp. Some people are only a candidate for that, so we can do that option for people. But the strip procedure is where you cut out a piece of the scalp and stitch it back together. And that's a little bit more uncomfortable because it's a a little bit deeper surgical type procedure. But most people have very, very little pain and it doesn't last for long.
That's awesome. It sounds like, once again, an option for everybody out there. But you heard her. Don't wait until it's too late. All right? I need y'all to go ahead and go to MD Hair Lab's website right now and go ahead and schedule that consultation. And come see this one, and she'll make sure that you take care of them, yeah?
Absolutely. Come on in.